Hello, folks. My name is Sean Park. Here we are in our Creativity and Humanism podcast series, exploring questions around how the arts and humanities may be of service in your work as clinicians in healing, in self-knowledge, in creating just, equitable communities, and in doing creative collaborative work. And so we're joined today by Dr. Bill Sutherland, who's going to engage in a conversation about some questions that I and my colleagues have. So Bill, thanks a lot for taking time to join.
Thanks, Sean. Thanks for having me here.
Great, and Bill, maybe just a bit of a thumbnail profile of who you are in your work as a clinician.
Well, I think to start with, it's in some sense nice to be able to come home. McMaster is my alumni in terms of both my undergraduate medical degree and my residency training in rural family medicine in terms of the postgraduate work and study and position. And as a physician, my career has morphed over time, partly by necessity from my own health and illness challenges. But I started off in full general practice on a First Nations reservation out in Nova Scotia, so doing full clinical and full hospital medicine. And then from there was a gradual change and morph into a more hospital-based practice, doing primarily emergency medicine, originally in a city setting and later exclusively in rural settings. And then also the hospitalist type work that comes with working in a rural setting, looking after the inpatients. And then from there, my medicine took another change, again, looking to sort of find the right alignment with what was going on in my life. And I did a fairly large change of scope of practice, going into primary mental health care and psychotherapy work. And it's largely a referral-based practice from family doctors and other specialists in the community, but there's some self-referral that comes in. And I find myself now in the north of Guelph, and this is my office here that we're filming or recording out of, on my end anyway. In addition to that, there's been other things that have informed my practice, besides the exclusive study of medicine as we generally think about it. I've spent a long time working with elders and teachers and healers from other cultures in both traditional, ancient, and even archaic types of practices, ranging from martial arts and healing study in Japan to working with our First Nations people, predominantly the Anishinaabe or the Ojibwe people here in Canada, to working with the Bushmen in Africa, descendants of the world's oldest people and the world's oldest healing tradition, arguably the anthropology showing a healing tradition that's 50, 60, 70,000 years old. So that has always been a big part of the informing, not only of my practice, but my own sense of my calling. And then on top of that, all of this has taken me into a study around complexity and systems thinking, a particular field that's called second order cybernetics, but as a type of method that's not the traditional scientific method of reduction and analysis, but a scientific method that's based on the notion of wholeness and synthesis. And I've found that's been a useful set of metaphors to help me situate my practice and really in many ways take it out of a sense of looking for illness and disease or a disease-centric practice into one that I would call health-centric. And maybe in some ways we'll get into that as that goes along. I think when it's all said and done, I like, as far as medicine goes, I like to think of myself as a country doctor. Wherever I've gone, it's interesting how many people end up by their own choice calling me Dr. Bill. Not Dr. Sutherland, but Dr. Bill. And so I think in my heart, I still hold that, so the aesthetic and the feel of what a country doctor practice is and what comes out of that relationship of the profession in community, with community, the community that you live in. And of course, that's not the only hat I wear. I'm a father of 4, and coming up close to 30 years of marriage, and all of the other relationships that all their forms that go out from there into the community. So anyway, just a little bit of a brief overview, but hopefully in some way that'll inform give some context for the conversation we're about to have. Thanks,
Bill. And I mean, also part of this conversation is, I mean, we're also friends, right? That's nourished in this. I mean, for both of us, around healing, right? Around creativity. That's partly what's brought us together as friends and as colleagues. And so, great. I mean, it's wonderful to sort of hear the journey that you've taken to be where you are now. And I'm just sort of seeing behind you, art. There's some art on the wall. You're in it. You talked about being a country doctor, and there you are in a rocking chair. that where you are, the setting reflects where you've been and what you're doing.
I think as we were saying, Sean, like before coming into the recording part of it, just allowing this conversation to weave and turn, not quite knowing where it will go or how it will ultimately end up serving, but maybe the art on the wall is a good position is a good place to start, because in itself was a product of a movement. So this art here on the wall that you can just see maybe a portion of was co-produced or co-created by my friend Andy McClure and myself. And my friend Andy is a professional artist and has been a high school art teacher. He's just coming to the completion of his career. He's retiring at the end of this coming month. And he's been a long-term friend of mine. We found each other through the ceremonial world and work of the Anishinaabe people and the elders that I've been working with and ultimately introduced to my friend Andy, and of course you've got to meet them as time has gone on and these things. And so that's where Andy and I's friendship started and grew from. And so this was a really interesting experiment. So what you see on the wall, from my perspective, wasn't to set out to make a painting. It was a way of capturing, on the canvas, a series of interactions and movements. That's really what it was. It was a dance of sorts, of movements, of interactions. And so we actually co-painted this painting together, and we had a set of rules or sort of boundary conditions that let us do it. And the rule was simply this: we weren't able to talk to each other as we both painted on the same canvas at the same time. And when it was done, we would both acknowledge to each other that it was done. And that was it. And an amazing thing came out of that. So we start to find our rhythm, we start to move, we start to interact. And at the beginning of it, one stroke of the brush by him or me goes on. And so now there's a punctuation on this blank canvas, and there's a center. And then from there, it starts to direct the further strokes that will come forth out of it. I'm just hearing the beeping of the phone, and so let me proactively make sure there's no ringing. And so, little by little, we start to add to the canvas together. In the beginning, there's a lot of ease in it because there's space on the canvas. There's space for his strokes, and there's space for my pigmentations and blotting. And at the beginning, it feels good together. And then soon, all of it, in the early stages, things to emerge that are pleasing. Not necessarily mutually pleasing or even mutually ultimately right, but pleasing to my sensibilities, to my opinions, to my taste, to my egoic position. And the same is happening for his. And then they start to conflict. They start to impinge. And the next thing I know, something, I'm like, oh, I really love what's emerging. And he takes his hand or the brush, and it's gone. And then likewise, he's working to bring something forward, and I'm like, and there, and it's gone. and we'll go through one good painting, and then 2 and 3 and 4 and 5, and any one of them could be a finished product in each of our individual minds. And then all of a sudden it turns to mud. It's like it's lost, and all of the frustrations and remorse and sadness, and we would be like, there's nothing salvageable from this. We just have the muck of it all. But I guess there was an unspoken rule to this, is we don't stop until, well, the original rule, you don't stop until it's finished, mutually so. When we push through, and out of that muck, we have this emergence. Things start to show, new centers become clear, centers within centers, and we start to let it inform us in a different way. And now our sort of desires and wantings have fallen away. We've grieved the loss of that. And now we start to listen to the painting and listen to the wisdom that's coming forth in the interaction. And at times we boldly take a move, or at other times graciously surrender and step back. And sure enough, then between the two of us, a third begins to appear, and that picture itself takes on its own, not only its own character, but an own personality, but in a sense, its own sense of self. And it's more than just a reflection of the two of us, which is already synergistically more than 1 + 1 = 2. But there is this third now that we're in conversation with. And at the very moment, and we've done many of these paintings together, the very moment that it is done, and it declares to us it's complete, we've always both known it at the exact moment, and we can't touch the canvas anymore. And that's the end of the process. And then what's interesting is how that carries on. So, this art's been on my wall for a few years now, and yet I still feel that I can have a conversant relationship with it, that it occasionally shows me something new that I hadn't seen before, that in many ways it will bring out a new story, a new mythology, a new reflection that's relevant to where I'm living, or it will speak to my patients as they come in, and they all get to have a relationship with it that has nothing to do with the relationship that I have with it. So that's an interesting piece. And so there's a lot in there. It speaks to the nature of interactivity, that the nurturing of the interaction between, first of all, my friend Andy and I, that we're nurturing this thing called an interaction, which is not a me and not a him, and it's not an us either. There's something that in the two, we understand the one, like we understand ourselves, who we are, only through this part of it. There's a notion of acting to know rather than knowing to act. So we don't know what the painting is going to be. There's no plan. We're not working towards a goal or an end point. We're just letting our action bring forth the next action. There's something about the notions of aesthetics and the impulse, and the notion of what is beauty and how we're touched by beauty, and what is coherence and what is harmony and what is dissonance. And then the paradoxes. When is the dissonance sometimes needed for the harmony? And when do you need to have moments of incoherence so you can actually hold sort of a meta-coherent position ultimately? And all of this, I can think, only has to, in some level, ultimately be able to speak to what is health. And if we just leap from there to what is health, isn't that really the question that as physicians that we should be asking all of the time? That should be our guiding question, right? What is health? The founder of osteopathic medicine, particularly in the States, what is now known as osteopathy, was a man named Andrew Still. And he was a medical doctor in sort of the sense of what that Civil War era medical doctor was. He was also an engineer. It's a time you could be many things. And he developed a new approach to his medicine that ultimately he called osteopathy. But again, the way to understand it is to understand it as an aesthetic opening, an opening to nature, an opening to beauty, an opening to form. And one of the things that he did really early on was, that the job of the physician isn't to find illness. Finding illness is easy.
Mm-hmm.
We all know to see it, and we all know how to find it. The real challenge, the real enjoyment is, how do we find health? And then that brings all sorts of questions. Where does health live? Health in the patient, health in ourselves, health in the interaction, health in the third that comes out between patient and doctor in that sacred relationship, of that therapeutic relationship, that patient-doctor relationship. And so all of a sudden, we start to get into notions that in looking for health, it's the same as looking for beauty. It's the same as looking for a capital F form. We start to find these different things. And as much of it is that, sure, there is a role for our understanding, there's deeply even more so a role for our not knowing, our role for our listening, a role for answering a call to an impulse. And so in many ways, and I don't know if this will make sense, but all that goes into this painting, in my mind, are all the first principles that are present for a medicine that is health-centric and honors health in the same way. And how could they be different? Because if you take a perspective of wholeness, all of these first principles that are born of wholeness will equally guide a painting, should ultimately guide our patient encounters and our sense of our role in it.
Yeah. And so, Bill, when you described the way in which you worked with Andy, you noted that one of the, I guess if you could call it a set of instructions or an algorithm or something that you would not speak to each other, like with your voice, that set up now your other senses to now actively pay attention to what's going on in the moment, right? To now be able to sort of sense changes and sense movement, right? That you're now much more in your body than you are necessarily, when you're talking, you tend to be more in your mind. So I'm curious about the value and the role of those kinds of instructions, constraints, algorithms, and actually helping us move more into sensing, more into that kind of improvisation that's grounded in what's happening in the moment rather than what our preconceived ideas of where something is going to go, needing to go.
I will, and before I do, I want to just actually point out an observation because right now I'm engaged in an act of seeing. It's an act of, through this medium called Zoom, I really am looking not only at you, but to you and with you. And one of the things I'm really, really aware of as you asked that question was your movements, as you find your own rock and your own rhythm and the use of the hands and how the breath and the tone of the question was delivered. And so right away, like, again, I just want to, that this is not a purely rational discussion that we're having. This is an aesthetic interaction that we're looking to tune to each other to. And you're tuning me in your movements and in your, we're trying to find a way to come into that co-tuning, that resonance. So I just want to put that as, this is really important because we can capture this moment and say, hey, everybody, look how Sean just asked me that question. That's really important. Look at how I'm endeavoring to answer it. That's important. Okay, now to the question itself, to the content. There's one thing I agree with, there's one thing I don't. It's not algorithmic at all. Or if it is, it's not an algorithm that I am aware of or open to. That algorithm is inevitably deep and unconscious. But what it is was what you also cited, and it's the second part, which is it is bounded, right? It's a set of boundary conditions. It's a set of limits. And it's that limits that actually provides us the freedom for this ever-changing creative expression. Every painting is very different. And by the way, it's those limits that make every painting different, because what we found, we still find, is the last painting we do has a residual, right, of the things that our ego likes, right? It's like, oh, I like that line, I like that flow, I like that blotch, I like that center. So the next new blank canvas, the ego goes, I want to repeat that onto here, right? But the wisdom of the process is, my friend's going to come along and go, and it's going to be gone really quickly. Can't hold that. Can't hold that. So there is something virtuous in the system we've created that allows us to remain fresh and open to something new emerging every time. But the notion of boundary conditions is really important for doctors, because if you look at the notion of the complaints we have on average on whole as a profession, the complaints that we ourselves as doctors have about the modern medical system and what we go through. And then you also look at the complaints that patients have about the modern medical system and that they go through. Take the negativity out of it, or the complaint aspect, and you realize often what we're speaking to is our frustration of dealing with boundary conditions. I'll give you some simple examples. There's never enough time, right? The 10-minute visit in the family doctor's office, the quick, whatever it be, like, the 5 to 30-minute check-in in the emerge, depending on the severity. Everybody feels the time constraint, the push, and patient and doctor alike. And everybody, so we have a boundary called time, and usually never enough. That's an example of the boundary condition. The nature of the doctor-patient relationship, particularly as it's well bounded and elucidated by our professional college, the College of Physicians and Surgeons in Ontario, right? They say, here is the moral frame that we are calling good medicine in terms of practice, in terms of fiduciary responsibility, in terms of legal constraint, right? And it's not without wisdom, right? But then we go, okay, but these things form us. I'll give you an example that's right now, the college, I think, strongly encourages this, for example, to use the OT and the Ontario Telehealth Network, not using Zoom, not using FaceTime, because this is in line with the law and privacy regulations. And, we have the server has its different things to ensure that privacy and patient confidentiality is maintained. And yet I have patients constantly saying, couldn't we just use, a technology that's not so bogged with traffic? Couldn't we use Zoom? I already know how to use Zoom, right? And so we have these boundaries and these frustrations, right, that come out. What I'm saying is they're not an algorithm, like these aren't algorithms. These are the real things that we have to deal with, accept, and give very little position to push or pull or far as change. And what I'm saying is that's great. Like that we say these are the boundaries. And then rather than getting in the same habit, right, like we're like, continuing to respond over and over in this very predictable way, can we find some way to start moving freshly and newly within these bounded conditions, right? So when patients come, I got to set time. We got to figure it out in this time. There is a set form that's based on this interaction, say called Western psychotherapy or the doctor's appointment. And yet in that, all of these sets, what are the freedoms? What are the creativities? What are the things that can move? And so we have a paradox that's stochastic, right? Where we have infinite possibilities in very finite, restricted senses. So then the next question logically becomes, well, how do we move into that place? And how do we move into that space?
So, this is wonderful. And I'm still with the painting here. And there's something that happens that's even before the painting takes place that I'm curious about.
Yeah.
That how do we, it can be easy to slip into, let's make this efficient. Let's do what we've already done before because we know it produced a certain kind of outcome. It might make this easier. So there's all of that stuff that comes. And then, sure, maybe we do need things that help make things systematized and easier. Great, right? There's also the reminder to yourself that as you step into this constraint, that there are these possibilities. And so I'm curious about how the artist, how the physician prepares themselves first before they enter into the interaction in a way that they at least make it more likely that they're going to be available to something new, to being fresh. And so what are some of the things we might do beforehand, before you go into those 10 minutes? How can we prepare ourselves to be fresh?
It's a great question. So it's not I wouldn't call it a preparation per se, as in like I'm preparing to have this kind of to be this kind of person before I go in. Because now we're stuck back in outcome, right? Like I need to be a certain thing before I start. When the truth is, you start wherever you are and whoever you are and wherever you're at. But it's a good question. I want to, there's something in it. And like you said, there's a notion, like you said, that often, and this is, you'll hear it, like efficiencies, numbers, outcomes, expectations, and we make that primary, right? Like we say these should be the primary measurements, goalposts, benchmarks that are the feedback that says we're doing right. But if you notice those if we, in having used those as benchmarks, we have often deep levels of dissatisfaction, burnout, fatigue. It's rarely a vitalizing process. So when you look at what's behind, so what is behind, there's two things behind it. So when you talk about efficiencies, numbers, outcomes, effects, there's two things we're pointing to. One of them is the notion of intent and outcome, like the final, right? Like there's a final, like the final product. So we have this notion of product versus process, right? We're making product the primacy. And then we say, okay, for this product, let's decide what processes are going to make that happen. And I would suggest that that's an inversion. Like if we go back to the painting, we're not actually trying to make a painting. We're never going, let's go do this so we have a painting to put on the wall. There's a calling. We want to be together as friends in this way. We want to dance and express in this way. And the whole thing is all process, right? Including the process of the snake eating its own tail when it all wraps up in the end. But it's not done there, right? Because it continues to inform, like just as it's informing our conversation here today. So one is slipping out of product and intention to process and attention. Right? Here we're doing it here, right? Like we never said, here, Bill, this is what, like you never said to me, this is the end product I need you to produce today, right? You didn't give me a list of questions. You didn't give me a, here's what I want to work through. You're not rush me, yeah, and into your next question. You can see you're not doing that in your form, right? So we're actually in process, and we're just paying attention to the flows and the change. And by the way, this doesn't have to be easy. I mean, it feels that it's going well in this moment, but in the next moment, it might go very difficult, and we might stumble and struggle, and there's room for that in this as well. Lots of room for missed notes, missteps. So one of the things to learn then is to say, before you go into the room to see your patient, that you don't get caught in the quantitative, the numbers, and you don't get caught in the notions of efficiencies, and you don't get caught in product, but in process, and not intention, but placing our attention on not only the patient, but my own internal state. So it's a dual attention. And then in this way, I'm recognizing that my body is actually my best instrument, more than my stethoscope, more than my ultrasound, more than my questionnaires. This is one of the instruments, right? And remember, this is the analog now of doctor and patient is that we're co-painting something called the encounter. Now, it is a little different because when my friend and I paint, we do it as friends and peers and equals, and that's the relationship. Now, and it's a relatively equal relationship. Now, the doctor-patient relationship isn't equal. The direction of care is towards the patient, right? We're not, so, but that's okay. This is just a shift in the form with and acknowledging it's just a new set of boundaries that are just part of the initial boundary rules. And there's many other relationships that this can be applied to. We just have to be respectful of the change of the boundary set. Okay, so that's the one notion, right? So beforehand, don't go into, do not start an appointment to finish it, because then you've already lost it, right? Go in, so what do you have to have? You have to have a sense of curiosity, a sense of inquiry. You have to acknowledge, I don't know what this appointment's going to bring, right? So really at some level, we have to let go of that controlling nature, right? To that a surprise will come forth. We have uncertainty and ambiguity, and we're already quite good with, I mean, especially in family medicine, we specialize in uncertainty and ambiguity. We specialize in, I don't know, like we have all these, you're giving me these issues, and I don't have an answer for you right away, and sometimes we may never have an answer. I'll say this is what you don't have, but we never get to what you do, because life is complex. Okay, so that's one kind of positioning that's towards the structure of process versus outcome. And attention to all of this versus an intention of what needs to be done. The other one that's to consider, and it's really important, actually this really makes sense in the time of COVID, is actually our sense of what time is, right? So when I'm coming into a painting with my friend Andy, we open up the day. Now, that's just a freedom. The truth is, it doesn't have to be opened. Like, it could be the 5 minutes in the emergency department. But more than opening up the day, that's the least relevant point. What's more important is we're shifting into it. The point is that we're shifting into a different kind of experience of time. And COVID is actually doing this to us right now because it's introducing us to a different experience of time, right? With the staying at home, the restrictions, these new boundary conditions. So there's two types of time that in a Western type of thinking we should be aware of. And the Greeks had two names for time. One was chronos, as in chronological time. And the other was kairos. And chronos was the grandfather of the major pantheon of Zeus, Poseidon, Hera, and Hades. He tried to eat his children, you know, and time does that. And that's actually an important mythology because time does eat, like chronological time feels like it's eating up the substrate of our living. And it is, because we are bounded, all of us, by this thing called our dying. And so there is, in a sense, whatever the fates, you know, the length of our yard, you know, the thread that we're giving, there is this eating that's happening. And you'll notice almost all of modern medicine is set up on chronological time, right? The patient appointment, the shift, you know, the hours, like we all are talking about it in this way. Now, don't get me wrong, we're not getting rid of chronological time. We're just bringing in other ways of being in time that, when it is timely, is going to allow us into the sense of aesthetics, beauty, health. Okay, now kairos time is not about a past or a future or quantitation or unfoldment. Kairos time is the ever-present, poignant, pregnant moment. Now that sounds wonderful, but it can also be hideous, right? Like, because it's the edge of the unknown, it's the place where real change and transformation can happen, but that's ruthless. It demands that we change and transform, and changing and transforming is difficult. And nor are we always going to be in kairos time, right? But you think about what we do as doctors, or what we do as artists. If we're coming at it from the perspective as an artist or as a physician, we're in the transformative business, ideally, right? Yes, we're hoping to transform the present state into a greater state of health, or a greater state of beauty, right? Or a greater state of wisdom, right? We are in the transformative game. But the mistake that I think we make as physicians, if we lock ourselves in chronos and chronology, well, that's not about transformation, that's about prediction, right? And there's some very strong merits in prediction, but we're not going to change the patient or ourselves, or more importantly, be changed by this interaction. That's the other thing, right? In chronos, in our intention, we're trying to help the patient change. But in kairos, everybody that's in there changes. The context changes, the environment changes. We're all changing, right? COVID is changing us all, and we're all feeding back and changing COVID, right? I mean, this is going through. So kairos is a very difficult state, because it doesn't assure that things will go well, and it doesn't ensure that things will go badly. It just ensures that things will change. And like the painting, remember I said there's a moment that all goes to mud. So often we have to make allowances that in the patient relationship over time, we're going to have, you know, conflict and stress and pull and not knowing and the senses of this isn't working, and frustration and failure and hopelessness, like these things flood in. This is part of kairos, and it's there for us to utilize, right, to change it.
So Bill,
yeah.
so as you speak, I mean, feeling moments where I'm here and I'm connected, and I'm not worried about anything else. I'm not thinking about anything else. There's that sense of being sort of all in, right?
Yeah.
And then, you know, because here I am at home, my wife walking around, and the kids are downstairs, and they're starting to kind of lose their minds, and it's almost dinner time, and I get the look about when's this going to wrap up, and then kind of feeling that, like, oh yes, okay, like this conversation is bounded, right? That by all of these responsibilities, by these relationships that we have, right? And then there's that conflict, right? That, oh no, whatever this is now, I need to change this because of these obligations or these responsibilities, and it's uncomfortable.
It is. It is.
It's very uncomfortable.
And I love that your kids' voices are in the background and that the house is doing this, right? Because this is not an ideal, like it ends up that this is real. This is what life is like. Now, when I say kairos and chronos, it's not an either or proposition, right? These things are always nested and enfolded and in tension. And it's that tension, right? The tension that's pulling you to the duties of the house, to being at dinner, to the kids' needs, to attending to me, as inviting me into this conversation, recognizing my poles are going in places too. And even now we're renegotiating, right, how this has to work in this moment different than 2 minutes ago. All right, so they're in tension, they're not indoor. And I'm just gonna show how this sounds pragmatically with a story. Can I just go to a story and maybe this will be the wrap up and we can have a future talk, or we can let it continue, or whatever the case. But let's throw in a story, right? So here's I think what's amazing. The story is 2 parts. Okay, that's 2 stories, but they're the same story. The first story is very short. When I take the pulse, or I listen with my stethoscope to the breathing of lungs, the minute I realize that something is listening back to me as I listen to it, i.e. the pulse or the breath, because the pulse and the breath are a reflection of life. And if I'm listening to life with my life, guaranteed, life is listening back and listening to me listen. And when I shift myself into that realization from the pragmatic, how many beats per minute, and are there adventitious breath sounds, and like all of those kind of things, like if I change out of that to recognizing, shit, something is listening back to me. Now I'm out of chronos and I'm in kairos. Even am I counting a minute of pulse, which is chronos, or how many breaths per minute, which is chronos. The minute I recognize they're listening back, I'm also in kairos. And even though I'm timed 1 minute, 30 seconds, 15 seconds, that moment of co-listening is timeless. It's out of time. And another way of saying the type of time that kairos is it's time out of time. Now, another story, which is the same story. When I come to my patients in the emerge, and I show up, like you said, that preparedness, right, of process and attention, and I'm stepping into kairos, they feel it right away, because something about kairos attunes us all to kairos, which means they're getting out of their chronos. I waited 5 hours in the merge, and they went before me, and they don't understand the triage system, and all of a sudden they get it pulled out of kairos out of chronos into kairos, and we're both in it together. And then I ask them my questions, sincerely waiting for their answer. And sometimes I'll bound it, like I'm also aware of the tension of chronos. I won't let them go on forever. I'll bound it, but I'll bound it in kairos. And then I do my exam and I listen to them listening to me, and they feel, and my touch as I do my physical exam in kairos, not chronos. A chronos exam feels like an invasion or kind of assault in some sense. A kairos exam feels inviting and opening and held. So chronos touch is very different than kairos touch. Doctors need to know this. And the minute we're all in kairos, my patients in the emerge go, thank you, doctor, that 5 minutes was enough. And then all of a sudden something happens. Hearts open, empathy opens, compassion, and I got to say, oh, I have to run over to this emergency. And they're like, yes, doctor, you go take care of them. You go do what you need to do. Because they're still in kairos. They're in timeless time. They've been taken care of in the time out of time. And the constraint of the 5 minutes is still the constraint. The pull to be somewhere else in the ER is still happening. But as long as I can keep falling back into kairos throughout my shift and inviting my patients to do so, then all of that problem called time, chronos time, and our frustrations goes away. And here's the difference. Rather than spend at the end of the day, I'm revitalized. At the end of this painting, I'm revitalized. In this conversation right now, as we go, and we explore this kairos together. I'm feeling revitalized. Our conversation, my story of the emerge and the picture, they're all the same.
Everybody like this.
They're all the same.
Yes. Yeah.
There you go, Theo. Good job.
Life listening to life.
Life listening to life.
Yeah. Yeah. I'm really grateful that this took its path without trying to make it go anywhere. I mean, it's right there in the room with you and then with us.
And do you notice how I'm getting goosebumps, literally, again, using my body as an instrument. My arms, my legs, my extremities, goosebumps. You and I both know that today in this painting, we're done.
That's it.
It found its way in its own capital W wisdom to come to its necessary completion without us having planned the completion in the beginning. We paid respects to each other to have space for you, space for me in our interaction. And the times that we didn't, and I took up your space, we just used those as missteps to, and to further move it. We navigated the tension of chronos and kairos of this moment and the moments of our respective contexts and environments, your home, my office, right? I just want everybody to recognize that all of the things that we talked about that may sound abstract are very, very real. And let's just speak to pragmatics. I think this did what it was supposed to do, at least for you and for me. You know, there is an outcome, there is a change, there is a sense of, oh, we got something from this, but without ever focusing on what that something is or should be. The pragmatics took care of themselves if we paid attention to the aesthetics. The illness took care of itself if we paid attention to health, right? Our ignorance, it was not an issue if we paid attention to wisdom.
Amen to all of that, Bill.
All right.
Thank you. Thanks a lot for this. Let's do more.
Yeah.
This is exciting.
Yeah,
this is great. Yeah.
I really enjoyed it. Yeah. Looking forward to more. Looking forward to more conversations.
Okay. So I'm going to stop it here. Here we go.